We'll call the meeting to order. We'll do the pledge allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Approval of the agenda. This is the newest agenda here. We have a couple of closed sessions. We're gonna do the labor one towards the end of the meeting. Probably after the, action items, I believe. And then we have the 9:05 dental appointment is gonna be pushed back to after our closed session at 9:15. So we'll just push that back to there. Is there anything else on the agenda that needs to be addressed? Yep, all right.
Motion to approve with those adjustments.
Motion's been made. Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye. Aye. Opposed, same sign. We'll move on to, approving the board minutes. January 7th. Everybody's had a chance to review those. Is there any additions or corrections? If not, is there a motion to approve?
So moved.
Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye.
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 Those opposed, same sign. Work group session minutes from January 14th. Everybody's had a chance to review those. Is there any additions or corrections? If not, is there a motion to approve?
I haven't had a chance to look them over yet. But I assume.
I'll make a motion to approve.
Motion's been made.
Second.
Cindy seconded it.
I'm gonna abstain because I wasn't present for that.
That's okay. No further discussion. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Public comment. Anybody wish to make a public comment? Olivia? You could sit up here on a table if you'd like. Okay, all right. All right. Consent agenda. We have 7 items on the consent agenda. Just want to point out on Marilyn Moore's resignation, retirement. She served 30 years here at Houston County. Want to thank her for that. Just wanted to point that one out. Any other questions or comments on the consent agenda? If not, is there a motion to approve?
I move to approve. As stated.
Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. All right. Guess we can move on to action items. Number 1, consider appointing Dewey Severson of La Crescent to fill the vacant position on the Parks Committee as a member at large. Polly.
Good morning.
Morning.
The Parks Committee was looking for a member of the public to fill the vacant position. So we were looking for someone who had a general knowledge and background of the park setup and how it's been handled in the past, along with being a fellow camper who could bring good suggestions to the table. Also in the criteria was that the person not be a seasonal camper at Wildcat. Dewey seemed like a great fit. So that was our recommendation.
He served on the Parks Committee when he was commissioner too, right? And this is for filling an open vacancy.
Correct.
Yep. We have a motion to appoint Dewey to fill a vacant position on the Parks Committee.
I'll move to approve that. Seems like a very good fit.
Kurt seconded. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Aye, opposed, same sign.
Okay, thank you.
Thank you. Number 2 is consider appointing Pam Hendel and Joni Schmidt to the Houston County Extension Committee for a 3-year term. This is to fill the open vacancies. We just did one here a while back with Mr. Privet. These two would be excellent candidates to fill out the Extension Committee.
Agree.
We're fortunate to get somebody to do that because it's hard to fill them sometimes, so.
Yeah, their applications were very good.
Joni is attention to detail, awesome,
Wonderful.
really good. I'll make a motion for that.
Okay. Motion's been made. Is there a second?
Second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Opposed, same sign. Okay, consider approving the payments, reviewing and approving payments.
I think you're missing 3, bud. Special services agreement with Samyot.
Oh, that's the old one. That got pulled, right? Yeah, you're on the old one.
All
Sorry,
right, no longer waiting on that one.
that was pulled.
You have this one.
The new one?
Yeah.
That's not there now.
Yeah. So, any questions on the payments? We have license center payments and auditor warrant payments, correct? And commissioner warrant.
I guess I'd just point out that it's kind of a spendy time of year when we have to pay all our property and casualty insurance. Some of them have different payment due dates than the others, so that's why some of them were run as auditors warrants.
Yep.
Is that twice a year? Twice a year on like the property stuff? Or is this one time a year?
All in January,
Okay.
for property casualty, workers' comp.
So all of these are fairly standard, nothing outstanding as far as new.
It is a spendy month.
We have our bond payment that's due. That.
For the Justice Center. That's gonna be paid off in 29, or is that,
Getting to get that schedule.
yep. It's in that vicinity, I believe, yep.
So 4 years or so?
That's
It's still
Pretty
4
close to
years.
being done, but
Yep.
So was that similar payments every year then for 4 years? or-
Yes.
Okay.
When the bonding was done, there were different payments schedules, so
Oh, okay.
when the money was bonded for it, there were 4 different ones, and they were all staggered with payments so that the annual payments stayed about the same.
Oh, good. That makes sense.
After review, they all appear to be in order. I'd make a motion to approve.
Motion's been made. Is there a second?
Second.
Any further discussion?
Nope.
Not all those in favor signify by saying aye.
Aye.
Opposed, same sign. I don't know if we want to get into discussion items yet. We're gonna run out of time. Unless Carol, you wanted to bring your stuff up yet or not?
You know, we're gonna be going through what I've been working on.
Yep. Okay.
Oh,
Oh, is this Susan?
Susan.
Okay, so we could go into closed session or as of right now?
Okay, Bree, I'm gonna put you in the waiting room, just so you know.
Yeah, I just wanna,
Thanks.
gonna do closed session pursuant to statute 13D-105 subdivision, attorney-client privilege to meet with attorney Susan Hanson regarding pending employment claim.
We need a motion in a second.
Need a motion to go into closed session?
I'll make a motion.
Second.
Any further discussion? If not, all those in favor signify by saying aye.
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 Aye, opposed, same sign. 10:16 to come out of closed session. Bob Schultz, Commissioner Schultz. Seconded. We just had discussion on, pursuant to statute 13D-05 on attorney-client privilege with Susan Hanson. Nothing was decided. And so,
Moving on.
moving on.
Okay, I got Bree in, so.
Okay.
She's in there. I panicked.
What you were asking was hard, technologically.
So now we have a dental appointment.
Ouch. Ouch.
I saw that on the agenda today. It was like,
We love dental appointments.
yeah, I
don't
thought,
we?
boy, that's a way to sell it.
Delta dental appointment.
Yes. So we're just getting reset up here. I'll just give you a quick startup and turn it over to Jordan. We've had a dental pilot here in Houston County for the last year and a half or so. And it's a partnership between Delta Dental, other healthcare plans, dental providers in our community. And it's been really successful. We're excited to kind of highlight that. Rich DeMarco from Delta Dental sent some information. And yeah, I'm just really excited about it. Just briefly, dental access is a big challenge, especially in rural parts of the state. It's not a new problem, and when I talk about this, I say it predates probably my career. We talk lots about how can we improve access to dental care for people, and not a lot of things have changed over time. This pilot that we're doing changes some variables that I think could really have an impact across the state. And so we're excited to talk about it today, and I'll turn it over to Jordan.
Yeah, just trying to get a hold of Rich, so I hope he can jump back on here in the next few minutes. But about a year and a half ago, a year and a half ago, we started a collaborative group with some staff in our office. Mary Zafke, our public health nurse, and Bree, our health educator, sit on our collaborative group, and we thought, what can we do to kind of make an impact on dental? Because we were seeing such a gap in services. And we kind of came up with the idea, let's just invite the providers within the county because none of them were taking MA patients or seeing MA clients. So let's bring them to the table and just kind of have a conversation of maybe there's some troubleshooting that we can do to just bring some services back to the county. They said yes. to coming to the meeting. And so then we thought from there, well, let's open it up to not just the providers, let's bring in the health plans too. So we made some contacts with some health plans and they said yes. And then from there, we kind of invited a few more people to the table and we just troubleshooted, like, how can we come up with some solutions? So our first meeting, we determined, let's bring in a traveling dentist. Had some contacts that kind of pushed us to the right direction. And then also supported us with funding. UCare provided our first grant. The traveling dentist came once a month, which worked out great. They were seeing all ages. A few months in, we met again for a second time. The providers in the county kind of got to voice, like, this is what we're struggling with, this is what we need to see these patients. And then from there, we decided to run out. That was kind of how the pilot program came to be, which Rich will explain when he gets on.
I think he's there.
Oh, he is there. So it's just kind of been right people, right time, lots of work into it, and we're just excited to where we're at now. We also have additional funding, so we're seeing our traveling dentists come 2 times a month, which has been great. And then we've got the pilot program, which I will let Rich kind of step into if he's ready to go.
Can you hear me okay?
Yes.
Right, Jordan, do you want me just to take it away for a few minutes and
Yep.
tell my part of the story?
Yep, you go right ahead.
Okay, well, good morning. My name is Rich DeMarco. I work with Delta Dental Minnesota. I've been with the company 10 years and have worked with the Minnesota healthcare programs for that entire time. Before that, I was with Blue Cross Blue Shield of Minnesota and also worked with the Minnesota healthcare programs. And so I'm going to just spend a few minutes talking about our view of this pilot and the results. And I do want to start with the most important part of the entire story is the Houston County, John, Jordan, creating a dental access group that included the managed care organizations, Delta Dental, providers, Children's Dental Mobile Services, and others. I think it was back in 2023 that started. And that's the first time I've been involved with a county initiating, bringing all of the stakeholders together. The dentists were part of it as well. So that was key, and I can't say enough about the leadership of bringing all the stakeholders together with a blank sheet of paper and basically asking, what can we do to improve dental utilization? So from that, we decided in 2024 to pilot a couple things: additional mobile access with Children's Dental, care coordination between Delta Dental, the dental office, and the county. And what that meant was if a member was trying to find a dentist but was having challenges, we would get that person to our customer service team, and we would coordinate with the dental offices and the county to get that appointment scheduled. And that was significant. In addition to that, we also connected with the dentists in the county. A lot of dentists right now are very busy. Some don't have staff, or they have full schedules. But we were able to work through our care coordination team to get the appointment scheduled. So the pilot ran from May through year end of 2024. And with a handful of interventions, the utilization increased by 70% in Houston County between May and December compared to the previous year. And that's a significant increase in dental utilization. So we are now we are calling it the Houston County model. I had a county from up north call 2 weeks ago and ask, can we do the Houston County model? And I'm meeting with them next week. And then we think that this model and this solution can work in 20 plus rural counties throughout the state. So we're partnering with mobile dentistry right now, a handful of mobile dentistry vendors, and looking at the care coordination model that we developed really with Jordan specifically on a day-to-day basis. And I don't know if Mary's in the audience, but Mary as well. So I just want to thank Houston County. I want to thank Jordan and John for the support. It was really their pilot. Delta Dental provided project management resources to make sure that we had some arms and legs, if you will. But it was really the vision of John and Jordan that helped create this. And now we're going to create basically a roadshow of this pilot and bring it to other parts of the state. So Jordan, did I miss anything or is there anything you'd like me to expand on?
Just that we're gonna run the program through the next year is the hope, or the pilot, and then just kind of continuing what we're doing, so. We're just
Yes, we're
excited.
gonna,
Yeah, go ahead.
we're working on, I'm sorry, Jordan, we're working on the additional support for the mobile dentistry. And then we'll continue to do some of the work we've been doing with providers and we'll continue through this year, yes.
I think the thing that's encouraging to me is, it's really, I don't know, it's really rewarding when you bring a group of people together who all want to roll their sleeves up and try and come up with solutions. And Rich is right, we had, obviously, he and Delta and other payers, Minnesota healthcare plans and providers, and our staff at the table saying, what's it gonna take to improve this? And the things that are part of the kind of what Rich is calling the Houston model is some of what we did to bring it together, but largely it's Delta saying they're gonna change some variables based on input that they got from providers. And we're excited because we see it making a significant difference. I mean, how many people have we served with dentistry in the last year and a half? You know, several hundred?
Maybe not quite that, but close. Yeah, that didn't have anywhere in Houston County to go before this pilot program, so, yeah. When Children's Dental Services comes down the twice a month, they can see up to, I think it's 7 to 10 patients for the day. Or more, depending on the age range of people, and their clinics are full when they come down the 2 times a month, so,
With waiting lists.
yes, with a waiting list.
Our staff too has been outstanding. As you've heard us come before you and talk about the pressures that we're seeing with new responsibilities and stretched with staff capacity, they're still doing a great job and have been leaders as Rich has highlighted here. So Bree Caesar and Mary Zafke, very instrumental in this work, and just very grateful to see how this has shook out.
So Mary, would you like to come forward and give your input a little bit? You're welcome at the table, just like everybody.
I'm just the person in the back, making the connections, sending the referrals.
Okay.
And maybe one thing I'd add is we've done very.
Why don't you come forward so people can hear you for the tape?
All right,
Didn't mean to put you on the spotlight, but
That's all right.
just so we can hear you and see you, so.
that's all right. I'm, 2 things I would add. One is that, I think relationships are really important to the work that we do. And because we're a small county, we have relationships with those local providers. And then because of the work we do, we have relationships, with the state stakeholders. And so, I think when the ask was made, people were interested, and that's really great. The other thing is that we've done very little marketing. Like it just
Word of mouth.
there's something going on, and people were looking at traveling to Wabasha, the Twin Cities, Rochester for dental care, and that became a burden for many people. And this is a great opportunity for people to get dental care locally.
And we will say too, it's not just the hygiene appointment, it's the dentist appointment, the treatment that they also get, that Children's Dental Services does. So it's kind of full circle, which has been really great, and families
they
are very
go?
appreciative. I'm sorry, what?
Where do they go?
They come to our building, public health building,
You gotta,
a dental,
You will see a big white bus
Yeah.
when they're
let's say,
there.
is it a mobile?
yeah, they come into our immunization space, or our clinic space, and they set up for the day in there, so.
That's part of what we're wanting to do with this renovation we've been talking about too, is provide better facilities for that. Right now, that mobile chair comes in and a provider and an assistant, and they gotta go outside the room to change their mind.
Yeah, you're gonna have a more specific space, a bigger space for this in the
Correct.
future, yep.
And you said you wanted to increase the mobile services that you currently have, or what are you looking forward in the rest of the pilot?
We're gonna continue with what we're doing 2 times a month. That's what our funding has right now. So we'll have to continue to search for additional funding to continue that. We've got funding now, I think, for the next 6 months we're set. So to continue that, we'll search for additional funding, but 2 times a month has been pretty good for us. I don't know if we'd increase that quite yet, but, yeah, and then just continuing with the local providers and the referral system that we have comes mainly through Mary and Bree, so it is quite a big ask from county staff, but we'll continue to do that because it seems to be, I mean, that's part of the care coordination pieces that we have a stake in that too, so. Yeah.
I think the point was made about how this has been a good learning experience for the provider, Richard. I mean, for you guys, I'm sure you learned a few things about this whole venture.
Yeah, the biggest learning, I think, for us is the importance of the support that we need to coordinate for a member to get an appointment. So, you know, there are times where it's just Delta Dental working with an individual, or there are times where Mary is working with an individual, but when we come together and we're aligned to the dentist and we're all working to provide the support at the same time, the same way, that was the big learning here, is that it really takes sometimes 2 or 3 levels of support to make things happen.
So providers in Houston County we want to give a shout out to as well would be Herman Dental here in Caledonia, Houston Dental in Houston, and Destination Dental
In La Crescent.
in La Crescent. They've participated in our meetings and given the feedback necessary for the project to be put together to make a meaningful difference.
Great.
Rich, I'm wondering, there was a chart that you sent this morning. Are you able to show that? Or if not, I think we can show it here too.
Let's take a look here. Can you see it?
Yes.
I think you're referring to the pilot. I don't know if you can see my cursor, but the pilot started about here. And this green line is 2024. And you can see the difference over this time compared to 2023. And it's such an exciting result, but there's still so much work to do. So I feel like we have momentum, but we still have a lot of work to do to continue to increase utilization.
Good.
And the key is to find the future funding for this.
Yeah.
Correct.
That's the hard work.
But we've been, Delta Dental has supported us, UCare has supported us, and so, we'll continue to reach out and try to find additional funding where, and that supports the funding supports the traveling dentist to come to the site, and it's like their travel time to get here to set up, it's the non-billable stuff. Indirect, yeah, costs that we're covering for that piece of it, so.
Yeah, Children's Dental has grant funding or funding that supports the actual services they're providing.
Right.
But the trick there was how do we get them to come down to Houston County? And so the grants that we've gotten from UCare, from Delta, and the work we're doing there is to help get those providers to come remote.
Correct.
And offset their costs related to that. Our plan is to continue the pilot. I mean, we're seeing a significant increase in utilization. That means people with better dental health, means kids in school that aren't sitting there trying to learn while they've got toothaches. It means more preventative, hopefully, so we're seeing less deep end dental things like extractions and such. So, you know, we will continue to work together. We'll continue to try and find the grant dollars to support those mobile dentistry. And our staff will continue to provide the support necessary to work with Delta and Rich and others to keep that process going forward.
So, Bree, do you have anything to add that you would like to say, or?
I don't have anything else. I don't think that hasn't already been said, but I do know that our community has been really receptive and appreciative of this program. So it's really exciting that we've had the success that we have. But that's about it.
Okay, thank you.
And if anyone is looking for the referral form or the consent form, they can call the public health office or email us. It's on the website, the email address is on our county website. We'd be happy to send out the referral form to anybody that would access it.
And I would also say that Children's Dental Services sees anybody, that it's not a child that they just see, they see adults too, so.
About the age of that,
cover
yeah.
the
That's a good point.
age span.
What is it you've seen from like 1 to 103?
Yeah, let's see, maybe 98, I
98,
think
I
was
think.
our oldest
Okay, yeah.
individual.
Great.
Yeah, it's just not for a child, it's for,
Yes,
Not just for children.
seniors
The
as well.
pilot program is focused on children,
right.
but we have access for
Okay.
all ages. So
Yes.
the referral form will get you to where we need to go. That's part of the coordination on the county side is we're kind of sending the referral form where it needs to go. So,
But the pilot program is for the
Children.
children.
correct, yep.
I want to thank you and John and Jordan and Mary and Bree for getting this going, and it's put Houston County on the map for getting this started, so. Good work.
Thank you.
Yep.
Thank you, Rich.
Yep, thank you.
Yep, thank you, Richard.
Thanks, Rich.
Thank you.
Okay, Carol, you don't have nothing? I don't have a lot to bring up, just wanted to let you guys know I had a couple phone calls last week about the proposed solar project out at on 76 there. And so had discussions about that. And that's about it. Bob wanted to bring something up on the snowmobile trail stuff, so we can go to you.
Yeah, I think both Eric and I have gotten some ear twisting a little bit on that. I gave him a copy of a letter that the La Crescent Snowmobile Club gave to me. They invited me to the meeting last night that they had. And basically, the state's trying to make them remove all of the signage, et cetera. Kind of like they're jumping further, so Eric made copies there. Then also that they rejected the maps that the county provided from Brian because they wanted some other, I'm assuming more advanced digital form. I think Polly was in on that. And they're less advanced on providing any form of a digital map than we would be. So they're looking for what other help that we can help revisit this, et cetera. The La Crescent Club provided me, and I gave a copy of this to Eric to give to Polly. It's a copy of the land use trail permit that they provide to all the landowners, and asked if it was possible that the county attorney could look at that, maybe review it, provide a copy of that to the state to see if that would be suffice, because they have made comments about knowing about the use or et cetera in our Zoom meetings and taking it a step further to make this better. Literally, if they close or remove their signs from the state road right away, if we get enough snow that these clubs throughout Houston County that we are the sponsor of by statute, and they remove these signs in the road right away, they could be removing a stop sign for where the snowmobile trail enters a road right away. The snowmobilers could be killed and seriously injured because they would have to remove the signs that they're required by the state and DNR to have. I don't even know where to begin with how they would send a letter telling them to remove this, because in essence, it will be closing their trails.
Yeah, that we've come to a point where, I mean, they're withholding all the funds now,
They
correct?
also stated in there that they're withholding all of their funds, and I think the La Crescent Club was a significant amount that, I mean, it could just about close all their organizations.
And I was contacted by the Houston Money Creek Snowmobile Club too, with the same comments that Bob got from his club there. And I don't think this is right that the state is doing this, the DNR and the DOT, that are holding us accountable for a state trail and for state roads.
Right.
And we are only the fiscal agent. We're not in charge of the trails. We're just the fiscal agent that passes the money, just divvies up the money to the snowmobile clubs.
I believe the way that they refer to it is we're actually the sponsor, and that's part of the responsibility of the sponsor is to provide the physical, financial
Fiscal agent.
disbursements, but I think we also have some form of overseeing the the permits, because I believe don't they get passed through your office too, Polly? The landowner type permits? So you've never seen those before?
Nope. That goes to the DNR.
So what's the county's role in that?
We're just the fiscal agent for the money to pass the money out to the snowmobile clubs. That's only been our role. And the state is requiring, the state DOT is requiring us to sign this LUP that
Right.
makes us liable for everything. And our county attorney has recommended us not to sign that. And all of the southeast regions, county attorneys have said the same thing. So it's just not Houston County, it's other counties that are denying to sign on to this as well. So
So it sounds like it's the DOT's interpretation of not having the sponsorship that they don't, if we're not liable.
that's the DNR's interpretation
Yeah.
that the fact that we're not signing this LUP, that they're not, then that they're not gonna pay the clubs.
So is there next steps in talking to Mark Schoenfelder or whoever, this is representing to clarify that? Because that's not, I heard those discussions too, and I don't remember that being brought up.
It wasn't at that time, no. I've reached out to Greg Davids, our representative, and also to Jeremy Miller. I've sent Mr. Davids some information on it. Because when I initially talked to him on the phone, he didn't know what I was talking about, so I emailed him some stuff. I have not heard back from him. So I'm going to keep pestering him.
So the local agencies that they suggest that could possibly assist the county as the sponsor are the snowmobile clubs? Or who?
See, and then that's where, from what I see and heard, I disagree slightly, because it says right on here that all trail permits are made out to the sponsor, not the club. And in talking to the president of the La Crescent Club, he said the county has always been their sponsor. So we need some clarification, probably from the DNR portion of the Grant and Aid Trails coordinator on if we are by statute the sponsor or not.
Okay.
Because it's right on their document.
Right.
We haven't seen any of these landowner permits from the county.
Yeah, to be brutally honest, I don't know that it was probably filed properly in the last 40 years that they've had trails. And that's kind of what the guy said, that they're playing catch up and starting in this corner of the
Might have
state.
changed, yeah, they might have changed what they were doing too, from the DOT's perspective. Huh,
But as my district, we've got quite a few snowmobile trails in the La Crescent area that definitely benefit our businesses and whatnot, even though we don't have snow right now, but it'd be an awful shame to see, number one, somebody get hurt, number two, that to lose our trail systems.
yeah, it's probably good we haven't had the snow, because this could, taking down those signs could really be a
I think we
liability.
need clarification on what the statutes are saying here, because it's in statute that a snowmobile can ride on state right away.
And then their hangup is the two-way traffic, but their letter that they sent to the clubs doesn't say make them a two-way traffic. It says remove everything in there because the county did not sign the permit.
They're trying to make us look like the bad guy, and that's not fair.
Right.
No.
So that's what's in their letter. So
Uh-huh.
what I'm hoping is that we can forward this other permit to our county attorney and make sure that we're doing due diligence. here.
Yep.
Yeah, I don't think, did your LUP even state that? Otherwise, so if you don't sign this, and if you're not partnering in this as a sponsor, then you'll have to have all the clubs remove the signs. They didn't lay that out
I believe all the clubs received the letter from what I
The
heard,
clubs received a letter.
prior to your discussion of not being a sponsor, though? Yeah,
just recently. So
yeah, I'm just saying
It
they
wasn't
didn't
said
lay
at the
that out,
beginning, no.
yeah. Because otherwise you would have discussed that.
Yep.
Well,
But our issue was, and the same way with our county attorney's issue was that LUP, it makes us solely liable for any damages, liability of an accident on a state right-of-way road. And, the contention is that is a state highway, that's a state road, it's not county.
yes.
And that was LUP provided to us by the state, but yet they have their sample one that all the clubs use and download. Why can't that one be utilized?
Exactly.
Because-
If the LUP was submitted like this one, language like this, we'd be okay with that.
I would like to see.
I would
county
say,
attorney
you know,
look
I
at
would
it.
dare say we'd be fine with that, but the fact that it's such a lengthy, detailed LUP, that's where the issue lies. And like I say, I mean, Fillmore County's denied signing that LUP. Goodhue County has decided, you know, didn't want to sign it. So. I think, you know, Commissioner Schultz and I need to converse with our representatives to try to get them to resolve this issue.
You can get them to call you back.
If we can get them to, yeah.
I was hoping that we could have that at least forwarded to our county attorney and maybe.
We
a
could do that
response
too.
from there.
We could forward the information that you have there, Bob, and have, County Attorney Bublitz look at that.
That was one of my meetings.
Might as well continue.
Sure, I also got a couple calls on the solar, just people questioning where we're at and concerned about, one was concerned about the moratorium, one was concerned about the actual facility, and wanted to remain anonymous. So. It's good.
Commissioner Zender, you have anything?
Had a lengthy conversation about the solar. One of my neighbors, because it's in my backyard basically.
Oh, okay, yep.
He was told, I think it's misinformation, but he was told that, he said it would look better, so he doesn't have to look out his picture window at it. It's bad enough he has to look at the power station. I said, well, he bought the house after the power station was there. That being said, he was told that you couldn't put like a tree line around it to,
Screening,
yes.
that's what we need to discuss in our ordinance, future ordinance.
So I went ahead and went to Mapleton, Minnesota. They have a fairly significant sized solar field. And they have a nice set of trees all around. It looks like arborvitae. And I'm like, well, this guy is not against the solar. It's progression, just how it looks. So if it's something that we would put in there that we should have
Screening.
screening, what do you call it, what you want, arborvitae, trees, whatever, to make it look, he would be happy. So,
Yep, that's something that we need to look at.
and I guess I agree with him.
Yep, future ordinance, it's definitely, yep, that's, the ones I provided you last week had that stated in there, yep. Yep. Anything else? Okay. Commissioner Wright?
Yes, let's see, I've had a few meetings, committee meetings, believe it or not, so far. And also have been setting up some more orientation for me to know some of the county management as far as that goes and what they do in their areas. It's been very informative and I hope to continue to do that because I'm just scratching the surface at knowing more about each area. Also met with Veterans Committee to find out more about, their services with that. And this week I'm going to our County Government 101 session up in St. Paul to learn from their perspective and a lot of colleagues in county government. So hope to do that. I've also heard from a couple of people about solar concerns. And I think it's great to add to our list of aesthetics or how it looks and how it's, going to be built out in our consideration that we have of different things that we need to consider and put into an ordinance as well. That's about it.
Okay. I think we have a land use meeting scheduled at 1 o'clock too, is that right, Carol? Yeah. And then you have negotiation meeting here quickly, hopefully.
Wrap up here, they're.
Okay. Okay. All right. Is there any closing public comment?
You actually have to have the closed session.
Oh, I'm sorry. That's right. I forgot about that. Sorry. Okay. Is there a motion to go to enclosed session?
So moved.
Minnesota statute 13D003 subdivision 1, discuss labor negotiations.
Second.
Okay, motion been made and seconded. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Commissioner Zender voted to come out of session, closed session at 11:37. Commissioner Wright seconded that motion. And it was just ongoing labor negotiation talks.
No action.
No action,
Action will be taken.
no action taken.
We'll
So-
have to take it back to their group anyway.
Yep.
I'll take it back to their group.
Right.
They're having a personnel meeting, negotiating meeting here after this meeting, so. I've asked for a closed public comment. Believe we have any. Is there anything else needs to be bring before the board?
No.
If not, is there a motion to adjourn?
I motion to adjourn.
Is there a second to that motion?
Second.
Any further discussion? If not, all those in favor signify by saying aye.
Aye.
We're gonna wait for.
Motion carried.